Hello and good day, everybody. Welcome. Welcome to a webinar, Planting the Seeds of Engagement, Innovation and Organizational Learning, a Northern Canadian Tale of Quality Improvement. This webinar is hosted by the Office of Lifelong Learning at the University of Alberta. My name is Khalid Aziz. I'm the Medical Director of Quality Improvement at the Office of Lifelong Learning in the Physician Learning Program. The Office of Lifelong Learning is committed to providing reliable updates and resources for clinicians, healthcare professionals, and everyone committed to advancing their practice using a quality improvement approach. I want to acknowledge that this webinar is being held on the traditional territories of First Nations, Métis, and Inuit people whose footsteps have marked these lands for centuries, and this acknowledgement is particularly important given our wide commitment to improvement of quality across all Canadian jurisdictions. I'd like to start with some housekeeping information. Please use the chat feature if you have a question about technical difficulties or any questions about L3 programs or services. However, if you have questions that you'd like to ask the presenters, use the Q&A feature of the webinar at the bottom of your screen. If you have a question, it may be worthwhile looking at what's already been asked before asking your question and upvoting those questions that you'd like to be answered. We can't guarantee that the panelists will get to all your questions because at times we have loads of questions asked, but we'll do our best, and you can always communicate with us afterwards. This webinar will be recorded, and everybody who's registered will receive an invitation to watch the recording. And participants can claim CME credits for personal development using a tool called My L3 Plan, which is available from the Office of Lifelong Learning website with this QR code. Although this webinar hasn't been formally reviewed by the CFPC or the Royal College of Physicians and Surgeons of Canada, it is eligible for non-certified credits. Main participants can earn additional credits by completing a linking learning exercise. So I'd like to go ahead and introduce our speakers. We have a whole team here, and what I'm going to do is introduce Andrea, who will then introduce the rest of her team. So I'm very pleased to hear this exciting EPIQ story from the Northwest Territories showing how employee engagement, strategic partnerships, and vision for team-based quality improvement has planted the seeds for quality improvement system-wide. Andrea is a psychologist by trade, but has worked and lived in the Northwest Territories for the last 14 years. Working for the Northwest Territories Health and Social Services Authority, Andrea's had the privilege of serving families in remote communities of the North as a frontline practitioner, regional manager, and a territorial manager of the mental health and addictions. And she works alongside many valuable partners in the community, health, social services, and local governments. Her passions are in health leadership, and she focuses on developing collaborative relationships, strategic partnerships to drive large-scale system change, and supporting and developing health leaders navigating complex systems and managing change in their units, divisions, and organizations. In May of 2022, Andrea transitioned to a new role as organizational development and leadership consultant for the authority under strategic learning and talent development. I know Andrea through the course that she teaches, and she's a student advisor at McGill University's De Sautel Faculty of Management, specializing in healthcare management. And she also holds a Master Facilitator designation for the Evidence-Based Practice for Improving Quality, or EPIQ program, and has been actively bringing EPIQ learning opportunities to the Northwest Territories and leadership teams. So I'm really excited to hear this presentation because she's one of our stars in quality improvement and her team is doing amazing work. So I'm going to hand it over to you, Andrea. So looking forward to this.
Hi, everyone. Thank you so much, Khaled. And thank you for the team behind the scenes on the Zoom call. I'll do my best not to have any Zoom bloopers. I'm just going to ask the team to start their videos so we can see all of you. And I'm going to start the slideshow now. Can everyone see that okay? If at any point there's an issue with my volume, can you flag me and I will adjust right away, but everyone can hear me okay?
Yes, we can hear you and see your slides.
Great, excellent. Okay, well, welcome everyone, and thank you so much for such a great introduction. But I'm really excited to be here today to share a story. We're here to tell you our story, Northwest Territories' story of quality improvement. And I'm really pleased that I'm here with our team. And before we get started, I'm just gonna introduce our team. You'll see their faces on the screen. And we'll start in order on the screen here. Natalie.
Good morning, everybody. Welcome. I'm the Territorial Manager of Quality and Best Practice here in the Northwest Territories.
And Natalie's located in Fort Smith, Northwest Territories. Glen.
Good afternoon, everyone. My name is McPhee. I'm the Quality Risk Manager here at the Hay River Health and Social Services Authority, and very excited to be taking part in this, and looking forward to all the questions that may come afterwards. Thanks.
Jordan. Hi, Glen.
Hi, I'm Jordan Bassett. I'm the Quality Improvement Coordinator at Hay River Health and Social Services Authority, and look forward to today.
Hi, Jordan. Sarah.
Hi, everyone. I'm Sarah Fitzgerald. I'm the Quality Risk Manager for the northern regions of NWT, and I live up in Inuvik.
Hi, Sarah. And we are missing one of our valuable team members, Tembi. She is actually in a new role. It's part of why she can't be here today. She's not able to change her shift. She's new Stanton Hospital Manager for psychiatry. And this is our team. This is the team that has basically been kind of grassroots with us right from day one. So we're really excited and we're going to jump in. I'm just going to step back in the slide here to get started. Just a few disclaimers before we jump into our great conversations today. One, we have no relationships of any commercial interest whatsoever, but we wanted to really let you know, as an important disclaimer, our why. Where did this come from? Why did this start? And first, we talk about engagement, but we were hearing in a lot of different groups, having conversations with frontline staff, with regional managers, that there were some struggles around quality improvement or projects that were aimed at improving quality. And some of the challenges that we were hearing were, we're not able to define what it is that we're going to improve. We're not able to agree on what it is that we need to improve first, or how many things we're going to be prioritizing. And we don't have the tools and resources to do so. We also heard that it was taking a lot of time. So to figure out all of these logistics and definitions and getting everybody on the same page, the teams felt they were wasting a lot of valuable time. So this is what we were hearing, plus our story. And I'm going to just put my mental health hat on for a moment. This was born out of what I say serendipity. My work with Khaled through the IMHL at McGill brought EPIQ to our team. And as I was participating and training as a facilitator, I had a profound reaction to the knowledge, because we needed it. We absolutely needed it. And I was thinking of my mental health team and how we were really struggling in a lot of different ways. And if we could come together as a team, we would be able to move some things that we had kind of been, I say, kicking the can down the road for a few months, even a year or two, sadly. So what we heard, plus our story, plus this kind of, serendipitous present, this gift of EPIQ really led to meaningful change for us. And as we were setting up the training, I was thinking to myself, other people that we've talked to need this. So that's when I reached out to the quality team and a few other select folks. It was just trying to fill the 18 spots initially, but we had no idea what was about to grow basically from that. So we knew people needed accessible information and material to support QI projects. And we unknowingly planted a seed that created growth across our divisions that we didn't prepare for. Some really important disclaimers also is that we are not experts, we are lifelong learners, and we are collaborative in our work together, and we just keep learning about all the wonderful things around quality improvement and the fun things, because believe it or not, it is fun, and we do talk about how much fun we have. And we're also exploring how we can improve our organization over as well. There's lots of organizational opportunities that come from this. So just before, what we like to do when we have our sessions, we're really quite engaging. We have polls and music, but what we'd like to do is we'd like to get a sense of what your QI training is. And we have a Slido here. So if you scan the QR code, I'm just going to stop sharing for a second and share my other screen just to see how folks are responding. So as folks are completing that, did everybody get the QR code okay? And maybe we'll pop back as folks are completing it. Maybe I'll just pop back over to the PowerPoint, give you a few minutes. But the point here really is when we engage with our groups and our teams, we really want them to feel supported in knowing that it doesn't matter what your background is. That EPIQ provides an opportunity for everyone to learn practical skills and tools at each step. And I apologize for the grandfather clock in the background. So whether you have some basic reading or a basic knowledge or even a postgraduate certificate or degree, you don't have to come to the table with any of the advanced education. You learn tools that you can use tomorrow in your programs. And that's what we love about that. So we'll pop back over to that poll in a little bit. Okay, and I'm just making sure that I'm following my slides here. I don't want to miss anything. So I'm going to hand my slide over to Jordan.
Thanks, Andrea. Okay, so today we are going to have a few learning objectives. So we do really want to talk about our story of EPIQ. And one thing that we did is we are going through LEAD's capabilities and how EPIQ fosters. So we just want to acknowledge that. And for anyone that is doing the LEAD's training, we just wanted to showcase how EPIQ is fostering that. The next that Andrea didn't touch on lightly is that we do leverage employee engagement. So a lot of our sessions are very engaging, and it's creating a lot of innovation and a lot of opportunities for EPIQ within not just NTHSSA, but HRHSSA as well, and pretty much the Northwest Territories for us as well. And then we'll touch on our coalition. So a lot of what we are doing could not have been possible without the teams that were in place and supported us to continue this journey. So we'll talk about how, these teams fostered all of our QI initiatives. Okay, so we're going to get started with our EPIQ story and how EPIQ and LEADS go together. So I will transfer it over to Natalie.
So EPIQ, as you've heard, it stands for Evidence-Based Practice for Improving Quality. The content has been developed and is owned by the Canadian Neonatal Foundation. EPIQ supports systematic data collection. It supports data sharing and the use of evidence-based practice. It's a great quality improvement tool because it's deliberate, it's systematic, and it's a continual process that, as we've said, engages people in planning and implementing change, as well as measuring outcomes of that change. As you can see, there's been 113 participants or workshops internationally and 2,635 participants. Next slide, please. So the EPIQ program is based on a 10-step process for improving quality. It's a structure that is helpful to really unpack a quality initiative, and it starts with steps 1 to 3, which are about understanding the quality improvement goal. In step 1, you identify the problem. In step 2, you select your team, and in step 3, you brainstorm causes. As you move through the process, steps 4 to 6 are about addressing the problem and measuring the improvement. So in step 4, you choose your priority. Step 5, you map the process. And step 6, you identify your indicators, what you're going to measure. Continuing on, step 7 to 9 is about acting and explaining. So in step 7, you explain your aim. Step 8, you engage your partners. And step 9, you implement your change. And moving on to step 10, this is where you share your knowledge. So you're able to share your successes and really take a look and unpack your results that might be both expected and unexpected. Andrea, I'm going to pass the slides over to you.
Thank you. And for anyone on the line that knows all of the 10 steps, I don't know if you've ever found yourself saying, I really like step 2 is my favorite, or step 5 is my favorite. I feel like all of them are our favorites. And we often say it's our favorite, but we love them all. The next slide really talks, we mentioned leads. So thanks, Jordan, for mentioning the leads earlier. And for those who are connected to either the Canadian College of Health Leaders or the Leads Global or Leads Canada, Leads is a health leadership framework that basically articulates 5 domains for health leadership capabilities. The work for Leads was developed back in the mid-1990s by a team of BC health leaders. It's a health leadership framework for health by health. So this is really rooted in healthcare capabilities. So what makes an effective leader? So there's lead self, where leaders are self-aware. They're able to understand their emotions and manage themselves, develop themselves and demonstrate character. Under the engage others domain, it's around fostering the development of others. So really understanding team or employee needs and developing their skill set, and also contributing to the healthy organizational functioning. So how are we functioning within our teams? How are we showing up to the work that we're doing? And as we know, a lot of our teamwork, a lot of our projects, they're really complex and they're very time sensitive. Sometimes we have pressures internally, externally. So it's really about being aware of how we're showing up to engage other people. We're communicating effectively and building teams. Achieve results domain has 4 capabilities that sets direction, looking at strategically aligning any of the work that you're doing with the organizational values and vision, and along with evidence. So it's really about what actions are we taking, what are our outcomes, and how we're tracking them. What kinds of actions are we doing intentionally to implement the decisions that we've made, and how are we overall assessing and evaluating our outcomes? So, you're really developing this kind of very well-rounded, robust capabilities in our health leaders. For developed coalitions, this is really about looking at how we purposefully develop coalitions to create the change or to get the results that we're looking for. We know that we can't do a lot of this work on our own, so who else do we need to have at the table? It's really demonstrating a commitment to customer service, so always looking at who our stakeholders are and how we might be adjusting and changing how we engage so that we meet their needs as well as ours. How do we mobilize knowledge to navigate what we know in health can be very political. So we have very complex political environments. And from a systems transformation perspective, so this domain really focuses on the capabilities of demonstrating critical thinking, systems thinking, encouraging and supporting innovation across all divisions of health, and how we as an organization orient ourselves and our leaders to think strategically for the future. And how are we supporting and developing others to be champions that can orchestrate change over time? So if you have, we can also share a link at the end of the call to link to the Canadian College of Health Leaders. Why this was so important for us was that our organization is simultaneously improving, so using quality improvement to improve our health leadership training. The reason why we were crosswalking EPIQ with leads was that there is evidence of the leads capabilities when we teach EPIQ. And it was a great opportunity to link both of those frameworks together to showcase that as we're training our leaders, they're also developing effective health leader capabilities. So we were quite excited about that. And I'll hand this over to Jordan.
Okay, so the EPIQ principles. So we are talking about every team in every setting. So this is hospital or nursing stations, any other regional setting that we have, where everyone reflects on the current context, identifies change ideas, problem areas, and challenges. Then we have team-based learning. So we identify and engage quality improvements, multidisciplinary teams, even regional teams. So we, NWT is very spread out and very vast. We do have multi-regions, fostering diversity and inclusion and ensuring the right people are at the table. So when we do our sessions, we group everybody together and try to have similar people at the table to help really break down some of those silos that we're seeing as well. Then quality improvement collaborative. So we're using the specific QI tools and approaches, and we're building coalitions. We're also able to nurture champions. So, fostering the development of others. When we had first done this in cohort 1, you'll hear later on is, it really sparked something that, took off and really led us down this journey and why we're continuing to do it. And it's growing the networks, it's expanding change, it's really driving a lot of what we are doing in the Northwest Territories. And we're able to follow the science. So we're able to use local evidence and have that evidence-based. And then, of course, it's continuous engagement and support. So we offer all of that for any of our cohorts that we do. We offer support after, because not everybody gets to do their problem, but a lot of people want to see it afterwards. So we offer a lot of support.
Thanks, Jordan. Okay, so in this next section, we're going to talk about how we leveraged all of this great learning that we heard from others to create opportunities for EPIQ. And we're also going to talk about the coalitions that we established to support our implementation over 5 cohorts. I'm going to pass the mic over to my colleague, Glen.
Thanks, Andrea and team. So as you guys have heard, this is an amazing journey that we're all happy to be part of. This is a bit of the timeline, so it's amazing to actually look and see that March 2022 is when we started this. I was happy to be part of that first cohort that we're talking about, the excitement that was presented there. We had 15 participants during that cohort. Some of the highlights of this here is it was funded initially through PDI funding, which is Professional Development Initiative. We progressed through the first 2 cohorts under that funding. And then we were lucky enough to have Health Sustainability provide some funding opportunities through Andrea's work and through the team's work. And we were able to progress through and moving through the various cohorts here, as you can see. And it's gotten us to this particular point, and we're able to present on our story so far. And I know this story is going to grow to a tremendous level. The networks, as they indicated, are building. And here we are to the point of the coalitions that have been established here. So as it's been mentioned in this presentation, through the Faculty of Medicine and Dentistry, I'd like to give a little shout out to Khaled, who's on the call here. He's our host for this presentation. He's been an excellent resource for many of us. And so through this EPIQ process, and then also highlighting the fact that the network has been clearly established of quality improvement throughout the Northwest Territories, with connections through the the THSSA, which is Northwest Territories Health and Social Services, and our organization, the Hayward Health and Social Services Authority, continuing on throughout the North. So we're just very, very proud to be part of this. And yeah, and I think I'll turn the mic over to Sarah for the next presentation.
So I was just sort of reflecting on where we started as our cohort. And I think when you bring people who like to talk about quality, and in fact, it's part of our role and our job, we get super excited. And that's what we saw that first one. We like dived in. It was like, I don't know, it was like all this magic that was happening. And I guess I kind of wondered like, okay, so we're off to a great start. What's the next cohort's going to look like? Because now we're bringing in different administrators, different programs, different levels of within the organization. And will we see the same sort of results? And I think the value of EPIQ and how it starts out, it sort of breeds this curiosity. And then you see this happen in groups where they'll start to like all these ideas start flowing. And then it's all of a sudden there's a lot of interest and similar magic that kind of happens. And so we've seen that bringing people together who largely don't have any interaction together. And you put them in a lot of time together and you start feeding this information. And it's pretty incredible the way you give them a common language and tools, and then all this happens sort of organically. And so we've had people from higher level directors to continuum care, people more on the front line, managers, middle management. And what's neat is that, like, I mean, I don't think I worked really too much with Glen and Jordan in Hay River up until EPIQ. And so it was such an incredible thing that now we can network and we can actually leverage our strengths and spread those ideas. And that's what we're starting to see with all these different cohorts that are happening. I'm getting to know areas of the organization that I otherwise wouldn't have known. People are getting to know me and how we can support them. And so it's the EPIQ seeds are starting to take root throughout the organization. And I see that as being a really cool byproduct as well. And so I think the key thing for me is what I've known as a facilitator is if teams can come with curiosity, openness, and a collaborative spirit, then it doesn't really matter, you know, what your knowledge of QI is, or necessarily if you know what your job is or your job. It sort of happens, this magic, when you allow time and space for that. Next slide. So we have 6 facilitators now up and running and our master facilitator. And what's neat is that us facilitators were at that first cohort. So we've had both experiences of attending as participants and now using kind of our experience and all these tests of changes with each different cohort to sort of inform the way we deliver. And that's been a really cool experience of engaging in this process. Is I didn't start as facilitator, I started as participant. I think that was really important. And that's how we've started to sort of build capacity. You'll see on the side of the screen here, it really landed strongly with a lot of our leadership, which was really neat. We'd have these leaders come in from all parts of the organization, and we put them in these groups to go through the EPIQ steps with a little project or problem. And it was neat to see them come together and use all their little bits and pieces of knowledge they had to sort of work through this. And out of that was a lot of interest in what more can we do. And it was like it was fueled something. And as a facilitator, the most challenging part was trying to like keep us on task and like, we got to move to the next step, because you then have to interrupt this flow of ideas and thoughts. And so it was really a privilege to sort of see all these people now have these tools to actually apply to something and have all these light bulb moments going off. We've had a lot of positive engagement that's resonated with participants, and we're starting to grow a community of practice, of mentorship, and more organizational growth. So these little fruitful growths that are popping up in different places. And I think that what's happened is a renewed passion for what quality can look like in all areas. You don't have to have prerequisites. We we encourage the process to be kind of messy because it's not going to look clean and tidy, bouncing around the steps. And I think having that permission for people to just be curious and inquire was important. And it's been incredibly affordable investment. And so I think the excitement that imbues is fueling the momentum, and we're seeing it's working, and it's starting to become more and more gaining buy-in from everybody. And so we have lots of exciting things coming. Because as facilitators, we're doing our own PDSA cycles as we go, because there's so much to be gained in this. And so we've got a good group going.
Thanks, Sarah. So as we come to an end, we're just going to kind of wrap up some of the lessons learned, and we heard a lot of them already. We heard about the personal reflections that we all had, that curiousness, that openness, the chance for enthusiasm, the excitement that everyone had. I know, like with our first cohort, it was realizing that we had the opportunity to go through a project, and we were all on the same page. It was the just-in-time training that we needed. It was the tools that we needed to put the problem through a cycle, that we needed to determine what we were actually focusing on and what we needed to change. It also broke down the silos. So the networking that we have shared between HRHSSA and NTHSSA, that, we were going through the same problems, and that everybody had the ideas and kind of solutions that could be put forth for the entire territories. Through facilitation, we've built capacity. We've gotten the leadership there for us, supporting us, which is really, really good. And with having that leadership support, we are now able to get down to the front line where they actually need it. So that is, our capacity is to go through the front line. I think we've all gained confidence. We've all had some skills development, a lot of knowledge and a lot of sharing, which is really, really great to see. And I think it's just reignited the passion for improvement, which is what at the time the territories needed. There was a lot of quality improvements, and a lot has been done since March 2022. So a lot has been done since then. So it's really provided a lot of hope and innovation for the territories to continue with this EPIQ process.
And in addition to some of the leadership lessons learned, we've had a number of unexpected successes, and that reignition of passion for improvement has really shifted. And you see we've used the word excitement a number of times throughout this the presentation, but what we're seeing is within the training sessions, people are excited. They're shifting to kind of a focus on possibility and an excitement for the application of the framework and the tools, and using PDSA cycles and affecting change within the organization. We've seen an integration of EPIQ into frontline and leadership training. So there's a desire to use these tools to as a structure to help build quality improvement agenda within our organization. And within the quality and risk division, it's really helped us to have a structured framework to help enhance projects, to provide leadership and to provide support for quality improvement. It has also really fostered interdisciplinary knowledge as well as interagency knowledge between HRHSSA, the NTHSSA, across different departments. And it's provided us really with kind of an informal inventory of opportunities for quality improvement across our system. So with every participant supporting or submitting a problem statement at the beginning of each training session, we're starting to be able to understand and see where people are seeing a need for quality improvement across our system.
Excitement a lot, but the key takeaways really was that, and there's so many, there's a lot of key takeaways. Thanks everyone for sharing this story. EpiQ certainly fosters leads capabilities. So when I think back and I hear this, the examples that Jordan's sharing, and Natalie and Sarah and Glen, it is developing this confidence, these skills that we can actually tackle these complex challenges in a structured way. We can make mistakes. Some of a lot of what we talk about is that sometimes we are going to implement an intervention that's not going to go the way that we want to, but we're going to keep moving forward because we're learning from it. So even when we make mistakes, we're able to, or we learn from the mistakes, or we learn from the assumptions that we think, something's going to come a certain way. We learn together and we move forward together. Another key takeaway for us is that we really do want to focus on the frontline nursing, social services staff, and our physicians. I need to include physicians in there as well, because the magic that Sarah was talking about, the innovation is bursting at the seams on the front line. Our innovators are there. They're the ones who are finding new ways and struggling maybe to influence up. So we really need to engage at this level as we move forward. And we are integrating into standard training pathways now. So we'll be integrated into our standardized leadership training, but also keeping it open so that frontline can participate, and working with our executive and our managers so that frontline folks have the time to step away from direct service and participate, because it's so valuable. And one of the things that we noticed was the key takeaway, the importance of consultation. So when you participate in EpiQ, and I think, Sarah, you mentioned this and you touched on this, was that you just need a little bit of help, right? So it's like, well, what did I learn again? And how do I keep it going? And how you just want to be able to provide that support and the momentum. So we really took that to heart. And we want to just continue to build diverse coalitions. So for us, we're going to work with other local health authorities. We're going to continue to offer diverse training options so that, eventually we might want to include, we have been including our patient navigators, but individuals with lived experience. So some of our patients and families may want to participate. And I know Khaled, that's been done in other areas too. So we'd like to step into that world eventually. But more importantly, we want to continue to engage, continue to inspire, and support our system as they innovate and change. So we're really excited about where this is going, and excited that we have executive support to keep this going and just continue to grow. So that's our key takeaways. And overall, we're open for discussion for our team. So thank you so much for your time today.
Gosh, thanks so much, Andrea and your team, for a great presentation. Really nice and concise. And actually, I've got so many questions I'd like to ask, but I think I'm going to refer to the Q&As first, if you don't mind. And there is a question in the first question Q&A comes from Paula Giglioni, who actually is also an EpiQ facilitator over in I believe Saskatchewan. Is that right? Or Manitoba? But the question Paul is asking is, I know that EpiQ is directed towards small manageable change items. What I'm wondering is it having an effect on the bigger, more wicked problem issues? What I mean to ask, is it changing culture and breaking down silos enough that some of the bigger issues are now easier? Who wants to answer that?
Well, that's a great question, Paula. And just for those on the line, I need to thank Paula. She's one of our EpiQ facilitators who helped foster the development of us as a team. So thanks, Paula. And I'm going to open it up to our team to see if anybody wants to speak to this.
I can start. I think, I really think that it is breaking down the silos, like even just between the quality team when we had started with cohort 1, it really was breaking down those silos and presenting ideas and solutions that were engaging for everybody. And, we all had the same problem. We were all working the same problem in little different areas, and by coming together we were able to break down the problem together and recognize that it was a territorial problem that we needed to kind of build the team together. And even in just step 2, when you're building the team, it really opened up the doors to say, who else do we need on this team? And it made us start thinking more outside the box than just our departments. So it is breaking down the silos, and it is really helping.
I think I can further that with the fact that I believe EPIQ has really been looked at system-wide. So, right at the top level of the organization as a structure that might facilitate large-scale system change. And so there is an interest for sure in looking at EPIQ at all levels of the system. And I feel like it is also, as Jordan's alluding to, it's helping us work together as 3 regions and partner in that, break down those barriers.
And just to add that, I think what's exciting about some of the culture change and shift that we're seeing is that we are connected now in a way to tackle some of those wicked problems, where before we struggled with those connections and we couldn't get the momentum to move those big projects forward. So I think we're at the cusp of that as well. Like, we're still new, but we're getting there.
Great. There is another question from Eric in Edmonton. Eric's asking, and he's here at our office. He's asking, thank you for a wonderful presentation. You have mentioned a focus on engaging frontline staff and giving them dedicated time to work on QI work. But I wanted to ask if there were other strategies or approaches for getting QI work to be part of the daily work. Thank you. And Epic is an expert on improvement, so you're going to have to give him a sophisticated answer.
Any take? Okay, well, I'm going to take a stab at this one. Are there any other strategies or approaches for getting QI? First of all, we do have accreditation. So accreditation is, we're trying to build in the language of QI in all that we do. So that's one of the big pieces for us. But there's some other strategies that we've been working on as well. So we have some leadership training. We also have the we have QRMs, and maybe Natalie, you could speak to that a little bit, but we do have quality integrated at all levels of our organization and at a regional level. So those conversations are starting. And I just missed, let me go back to your question here. Part of daily work. So the other piece that we're looking at is when we start to map on leads, the leads training starts to build in this kind of concept of improvement across, like, for ourselves, for our teams, and for our systems. So I think we are kind of using other strategies like health leadership. We're using approaches where we're engaging regional managers and teams and shifting to make it a priority. And it's becoming part of conversations in staff meetings and through some of the accreditation work. And I'm going to kick it off to our quality team to maybe dive in a little bit deeper.
Hi, I think our structure has helped to integrate quality across the organization. Andrea mentioned accreditation. So we do have standards teams certainly across the gamut of the services that we deliver that are focused on standards compliance, and they are led by our territorial specialist teams. Each of those teams develop indicators and are meeting regularly to address quality improvement. I feel like the quality risk management team certainly drives quality through trend reporting, incident management, and supporting managers as well to identify quality improvement changes that could arise from, kind of more reactive strategies that we're seeing and tracking data and that means. Does anybody else have anything to add?
I think you hit the mark there, Natalie, and team. I'll make one comment because I just find it so intriguing. Since we started this program, we were lucky enough to have our team collaborate on things. But I'm always in pumping the tires for our team. So one of the amazing things that kind of came out of it from our own healthcare environment has been the introduction of a system program called Align, and that was kind of generated and created by our cohort here and my partner in crime here, Jordan Bassett. So Align stands for Learning Initiative Going North. I think this is touching on a little bit of the previous question, but maybe getting into a bit of Robin's question as well, maybe some of the fun and interesting ways. So I think adding that into your day-to-day and working towards that, you add fun in general just by doing that and by creating a system in-house. There's so many different ways to add fun into the different steps and add fun into the work. And I think having a great group of networking people, I hope you guys can see this, and I'm sure you can. We've all been smiling the entire presentation here. We get along so well. We feel more relaxed because we have such a strong network of people we can rely on. So find yourselves a network of people that have similar ideas towards creating quality improvement, that have a motivation to succeed in their organizations, and find a team. Like I think this is a very special thing that we've created in the Northwest Territories, and I think that's why we've been given an opportunity to speak at this panel. When I think to myself about the amazing connections we have, EPIQ led by Khaled, and we also have, the University of Alberta supporting us through this. So there's so many networking connections that come out of this, and I think I'm just going to do a little bit of pumping the tires, and I'm the ranting person of the group. But if you're talking about fun, I come into this having so much fun, and it's because of the team of people that we have. So I think maybe I'll just leave it at that. I don't know if I answered any questions, but I certainly wanted to add that in there just as a pumping the tires of our crew, because it's such an amazing group of people we get to work with every day. So.
Oh, Glenn, I love it. And one thing that we forgot to mention is that we use music. So, or we do like a really fun, engaging question, but we somehow incorporate music into almost every training so that when you're coming into the session, it's upbeat, you're kind of toe tapping. When we have break, and it's just, when we've done virtually, we haven't done a face-to-face one yet, which I'm in an engaging environment and that vibe. So I think because, like Glenn said, we all energy that we just, when we're together, it's just like boom. And it's really special.
I hope that answers your question, Robin. Robin is another EPIQ facilitator from Southern Alberta in the primary care networks. So thanks for your question. I'd like to ask a question. I think we've got a bit of time, and maybe there's more questions from the group. And I don't want to dwell on the negative, but are there things in the EPIQ program that we miss, that there's a gap which we would like, which needs filling, or which you fill in some other way? I agree. The fun issue has local context and needs to be added. But what else?
I just want to jump back to Robin quickly, Khaled. The other thing that I think is fun is using Jamboards. I think the Jamboards are a really good integration that we have kind of done with teaching EPIQ, and I think has really brought a lot of good engagement with it. So Jamboards are definitely a good fun way to kind of go through the steps. And then Khaled, for your question, I will answer quickly. I know one of the things is there's always lots of questions about indicators that we always kind of end the day of telling everyone to kind of think about their indicators so that we can kind of have a little bit more discussion. I think that there needs to be a little bit more information around the indicators. And then even when we're doing the slides, there is the driver diagram that's within the presentations, but there's no actual information about the driver diagram. So people do kind of get caught up in that when we do go into the breakout groups, is that they see a driver diagram, and especially because a lot of our participants have been, that leadership, they see a driver diagram and they want to latch to it, and they want to go and do a driver diagram. That's what they know. And we kind of tell them, well, we're not doing it at all. So it's really the placement of the driver diagram. Those are the two that come off my head. I don't know if anybody else had anything else.
Those are the ones I had in my mind. Yep.
I agree, Jordan.
Right, that's very helpful. We need to work on that. There's always opportunities for improvement. let's see whether there's any other questions on the. Sadly, Jamboards, I think, is leaving us. Google is going to drop Jamboards next year, which is so much fun.
It is, and I think they're going to use Miro, which is not so bad. Miro, or there's another one. We use that. Right. Yeah, so it's user friendly. I always worry about the login.
Now, Paula has a question. I'll just put it on live. Paula has a question, which actually was a question that I had at the front line. Could you give us? She actually says, "Are you getting feedback from your clients that things feel better?" And I had a similar perspective that, you know, a PDSA that really seems to work and made a difference. So maybe you guys could give us some insights into that. Great question, Paula.
I think this is just getting into some of the outcomes of our PDSA and any of the projects that are ongoing. And I know that there's some early day work that's been done, but I also know that there are some teams, and I'm not going to necessarily call out Sarah, but I think I'm calling you out. I know that they're like the Beaufort Delta region of the Northwest Territories has been doing a lot of really great work. So I'm not sure if there's anything that's coming out of those projects. And I think it's really good, interesting who are our clients right now. Our clients right now are our system as we build capacity, but I think we're early, you know, we're getting there. But I don't know. I'll cast that out to the team.
So up in Beaufort Delta, we did used EPIQ to inspire a hospice model, apply some measurements to it, come up with some aims, consider our barriers, our drivers, how we would collect feedback, reevaluate in the data. And so I think that that project alone was really successful with those who were involved and got really excited about it. And so we already have sites on other projects. And I think I can't remember which question it was about how do we ensure that frontline staff can participate in these projects, which is so crucial. I think it's so important to have frontline staff involved for sustainability, to ensure that we're on the right track, to make sure that we're preparing can build those balancing measures as they come up and the feedback. And right now, I think that's where we're at right now, is figuring out how we can build a team here who can continue to take on a small project with EPIQ steps. And so we're sort of exploring what that looks like right now. But admittedly, it's a bit of a challenge because I think it's so important to set time aside to really get into that space. Because I know with this project we did with the hospice model, even little bits at a time, it doesn't seem like enough. Like, you really have to allow yourself time to sort of explore these things. So I think when we're seeing the value of it, more people are willing to actually make sure they're setting time aside, not just side the desk, but actually like within, and leadership are also seeing that too. So they want to see support, however that looks. And so we're sort of figuring that out right now. But I think once they start to see the results, there's a lot more interest in what can we tackle next. There's like so much enthusiasm about how we can use this for the next thing. And so it's not really a very good, it's not necessarily direction or instruction how to pursue that, except that we're also in a similar position of how we can embed that in our schedules without it being, side of the desk stuff.
Right. There was a comment in the, thank you very much, John. There's a comment in the Q&A from Shauna saying Mural has better functionality than Jamboard. I think it's the benefit of EPIQ is you can actually choose whatever platform you'd like to use. Now, we've got only 3 or 4 minutes left. So, Andrea, I don't know whether you want to whether you want to close up. There is an evaluation QR code that's being put on the screen for this webinar. Please give us your feedback, anything we can do to improve. And Andrea or your team, would you have any last words before we close up?
For me, I have just a big thank you for the opportunity to share our story, and it's stay tuned as we move forward in this. It's not sure what's going to come, but we're excited for what's coming.
Well, thanks very much, guys. You guys, what you've done in that short period of time is absolutely amazing, and you know, you're a model for all of us. So I hope you don't mind. We're gonna be sharing this this webinar widely, and the people who couldn't attend today will also get copies of it. So thank you very much, all of you. Very much appreciate you presenting, and good luck with all your fantastic work.
Wonderful. Thank you.
Thank you.
Thanks very much.
Thanks, guys.
Great.
Thank you.